Thank you all for being here as we talk about the waiver waiting list and the new waiting list assessment tool, and then kind of answer questions or get comments from you all for ideas, information. I want it to be that kind of a meeting. I just have, I guess, a few minutes to share, and then we'll open it up to you for like questions, comments, ideas, and we'll be grateful for all of those. So I've met a couple of you before at some different meetings, and I won't share a lot about myself, but I'm Pamela Combs, and I'm the new superintendent of the Montgomery County Board of DDS, and the heavens broke loose. It is now raining. So I started the first part of June. I came here from Gallia County, where I was the superintendent there, and before that I was at Licking County, where I was the director of provider relations, kind of the position that Mitch has here in Montgomery. And before that I was a deputy director at Franklin County for Job and Family Services. So I've served all different sized counties across Ohio, and I really enjoy public service. I enjoy working at the county level and providing resources. So that's about my work experience. I am a mother of 3 children, and my first child did have significant health needs, and he had a physical birth defect that required 18 surgeries before he was 21. I counted them up today to add up how many surgeries it was, and it was 18. And a lot of speech and physical therapy. So lots of different things. He didn't qualify for our system because it was things that could be fixed through surgeries and therapies. But I can remember, I was figuring out I've spent half of my adult life seeking resources and then feeling guilty whether or not I got them, or was I doing the right thing, or choosing the right path, contacting the right doctor, the right therapist. Was I too hard on them? Was I too easy? Constant. I still think about it now. And now he's much older and an adult living on his own in another state. But I still think about, he really has a lot of anxiety. Maybe I should have had him in more therapy. Could I have done something different? But anyway, I spent many years seeking resources, and it was before the internet. So it was really difficult because no one knew or anything like Chris had. So it was all, I don't know, and just kind of word of mouth, and calling different nonprofits and trying to figure it out. But there was a path. It was just really, really hard to find. So I just want you to know that I understand that feeling as a parent, loving someone and just wanting to do every single thing you can for them. Also thinking about this meeting, probably the one thing that makes me the most anxious and upset in life is if somebody cuts in line. Does that bother you all? And it's not so bad if I'm in the slowest line, because that just routinely happens. But if somebody cuts in line, someone cut me off driving over here, if I have a reservation and then other people don't need one, and I try not to let it bother me, but I know it bothers most people. And then in this situation, add to it that you're in line for something to assist your child or loved one with a developmental disability. So that increases the concern over the reservation or the line. So I understand that anxiety, and that's one reason, as soon as I started here, I asked Kamar if we could have meetings like this, as often as you all want to have them, just to sit down face to face or through video, and just to share information, to hear your concerns or problems or ways that we might do things differently or better. So just most of you have younger children, correct? 20? 11.
11.
I'm saying that because you all look really young. So the waiting list has been around for decades. I don't even, we've worked with people who have been on the waiting list for their entire lifetime. So in Gallia County, we had people in their 60s who had been on the waiting list ever since the waiting list existed. So like 20, 30 years, they've been on a waiting list, waiting to get to the top of the list. So one blessed day when the county had some extra money or an extra waiver, they would get offered that waiver. So they were on that list waiting for that waiver to be offered. So now there is no list. There is no line. There is no reservation. So it's a pretty drastic change. It's not a simple change. We change all the time in the field of DD. I mean, all the time. We're changing everything. I think that's just the way of the world right now. But everything's always evolving, and I believe for the better. But this is a drastic change. This is a change in fundamentally how we provide and offer waivers. So it is a huge change, and that's why I want us to have this time together and to continue communicating about it. So here's what's changed. Most of you probably are aware of what a waiver is. Does everyone know what a waiver is?
I wouldn't mind if they're
Kind of. So a waiver, the history of waivers, it's really brief. Originally, I guess, I don't know, in the 50s and 60s or earlier, I know you all weren't alive then, I don't know why I'm looking at you, but I'll look at myself. Way back at the beginning of county boards of DD. So we started like in the late 60s, right? Like 67-ish. So many people were institutionalized in what were called developmental centers. For many forms of developmental disabilities that now people live in the community, especially in Ohio. Ohio had large numbers because we were very proud of our developmental centers and ICF. So they're scattered all over Ohio. Ohio has now started to close some of them so that people with disabilities can integrate into the community and live in houses or share a house and receive services like that instead of in a large institution. So the waiver came about because if you wanted your child to live at home and not in an institution, this is waiver history 101. So if you wanted your child to live at home and not in an institution, you could waive their right to live in an institution. So you would say, I'm waiving their right to live in the institution and I want them to live at home. And then the waiver was that funding that the family or guardian received that kind of sort of balanced out to the level of need, the degree of developmental disability, the level of need. Does that make sense? So that's kind of where that started from. Now, over the years, there's, of course, to make it more complicated, there's different kinds of waivers now. So there's just not the one waiver. There's a level 1 waiver, which is the lowest funded waiver. Is it like 5,000 to 7,000? So it provides some funding. Then there's a self waiver, and that's a newer waiver, and it's one that the family or the person with the developmental disability can decide more what they want to do with their money. So there's more options, but there's also more responsibility, like interviewing providers or contractors and making those choices. There's also the IO waiver, which is, I think, the most common or heard of waiver, and that stands for individual options. So that waiver is the one that is set up typically to fund someone if they cannot live at home alone or if they need substantial additional supports. So that's what that waiver does. So that's kind of the waiver structure. In Montgomery County right now, we serve almost 4,500 people with developmental disabilities. We serve them through early intervention, which is babies up through toddlers. We serve them through our mental health program, recreation. Come on in. We serve them through our service and support, all different types of services. I forgot where I was going with that. I looked to see how wet you were based on the rain out there, and I got distracted. So we provide all different types of services. So 4,500 people are the number of people we serve. Out of the 4,500, there's right at 1,500 waivers. Okay, so not everyone has a waiver. We try to provide as many services as possible without a waiver before a waiver is given. So out of those 1,500 waivers, about 1,100 are the IO or self waivers. Most are the IO waivers. And then about 400 are the lower funded level 1 waivers. Okay, so that's kind of just to give you an idea of how many waivers we have. So most county boards have about that ratio. We're average for the state of Ohio. No county has everyone served on a waiver. So that's kind of the ratio. Now, as we think about the waiting list, and I know that change is very difficult. I really believe that this new way is a better way. And I really wish it had been the way that we had always provided waivers. Then that would be the best thing possible. But throughout time and throughout our lives, we know that there's often we're doing something one way and then we realize there's a better way. And then we have to make that really hard change. The worst part for you all is you are the generation of the change. You are the parents and the guardians that are facing this time of change. Probably in 5 years, maybe even 3 years, no one will even know what you're talking about when you talk about fix the list or back when there was a waiting list, because we'll be on to something new. But I really believe this will be a better way. It's just this time of change, I know is sometimes confusing, stressful, trying to figure out what's the best, and are you getting everything that you can or should for the person that you're caring for. So I understand all of that concern. Now just a couple of more things. One question might be, well, why doesn't everyone get a waiver? If somebody has a developmental disability, why not just even give everyone a really small waiver? Waivers are funded through Medicaid and through the state of Ohio, but also through your county board. So for every dollar that is spent on services, we pay 37 cents. So 37 cents of every dollar spent on a waiver here in Montgomery County comes from property tax levies. So that's how we pay for those waivers. So that's why we have to be very vigilant and use a lot of discernment when we assign a waiver. Once a waiver is given, the waiver is there, and we commit to paying for it for the person's lifetime. So fiscally, we have to know we have enough money to pay 37 cents of every dollar that we say, okay, you can spend this. All right? Even if you move to another county, we're still paying your waiver. So we're making this commitment for a lifetime. Does that all make sense? So it's a very significant commitment. So in superintendent school, my first day, they said, okay, here's, you're in the field to serve people with special needs, developmental disabilities. Your number one job is to make sure there's money. I know I spend 85% of my time, don't I, looking for money, looking at spreadsheets, asking for money, fighting for levy dollars, because every dollar I can get, I can spend towards family support dollars, early intervention, additional waivers. So basically that's what I do most of the time, is I'm looking for ways to get more dollars. We're asking our county levy committee to give us a greater share of the levy dollars. We're continuously looking for funds, because with those funds, then we can provide additional waivers, family support dollars. One thing that we just did that I think the letter's going out tomorrow, Friday from SOCOG, is if the person you care for receives family and support dollars, we were able to increase that up to $1,400 through December. Several people were approaching the end of those funds, so I know it's not a lot, but at least it's a few $100s more that you can use for something. So if I'm gonna cut dollars somewhere, it's not gonna be family and support dollars, okay? And I make that commitment to you. We're gonna try to find every way that we can to help you and to help, yeah, you're doing a cheer. I know, it's good news. And that's more than most counties get. In Gallia County, families were at, I think, 1,000. Each county can decide that based on their funding. So we're strapped for cash, but I decided we can find that money. So we'll work hard and pull that money in from another place so that we can spend that and give that to our families. So I hope that kind of explains waivers, why we don't give one to everyone. Now, right now with the waiting list assessment, how that works is you go through an assessment, and if the person with the developmental disability has an immediate need, like an emergency, then we start the process to get a waiver for them. If the person has a current need, which means it's something that needs addressed as soon as possible, within, let's say, 9 to 12 months. Then we start working on that to make sure we can get that in place. And these are big dollars. I mean, the waivers range, they can just range based on the person, but they're like $20,000 on up. And it's based on the person's developmental needs. And that's what establishes what that waiver amount will be. So it's a lot of math, a lot of figuring out our funding and deciding that person you're caring for does not have an emergency immediate need or a current need, then you're not on any sort of a list. You still have your SSA team member, your connection with our county board. You can still receive other services. And as soon as anything changes, you can ask for another assessment, or whenever it's your time to come back in for another assessment. And when that changes, then we commit to there will be money there for a waiver. All right. I was trying to think of one example of like an emergency. One immediate need or emergency need that is being seen throughout the state of Ohio are called aging caregivers. So those are parents or a parent who's been able to care for their child or loved one with a developmental disability basically their entire life at home. Like they've used some family and support dollars, maybe a level 1 waiver, recreation, respite. So they've cobbled together care. So they've been able to care for their child their entire life. And now they're aging. And let's say that they're living with one parent and that parent passes away. Okay, that's an immediate need. You need to know that if you're caring for a child and you pass away, or you're no longer able to do that, like something happens, we step in immediately. Now, I know it's scary thinking, well, I don't have that waiver first. It doesn't matter. It does not matter at all. We are there, and we provide their needs. We will make sure that they have a place to live. And it's based on their level of developmental disability. If they don't have a severe developmental disability, they may not want to be around us that much. But if they have needs for one-on-one care or help in the home, we will be there. And we will be there to help them. So I just want you all to know that. One project that I hope to do starting next year, and it's something I did in Licking County, is to work with parents of all ages. But just how like we do a will and life insurance, it's to kind of come up with a life plan for what if something will happen to all of us one day, but when something happens to me, you know, what do I want to have happen next? Or what can I put in place with my house or my resources to benefit my child? So there are specialists in the state of Ohio who can come and do some workshops on those things and to help get that in place. One older gentleman, he was like in his 80s in Licking County, he decided he would buy his daughter, who was probably in her 60s, a house. You know, here he is, you know, ready for a nursing home, and he's like, but I want to take my funds and buy her a house. He donated it to our housing nonprofit. She had a couple of her friends move in, and so that house will always be cared for. It's part of that now, and she'll always remember her dad buying her that house and them being in that house together. There's just a lot of interesting ways that we can put things in place for as your children age. But anyway, that's on a side note. So I just wanted to kind of explain the process, what happened. There is really no line anymore when your child or person you're caring for has an immediate or a current need that cannot be addressed by a local resource. Then we will start that waiver process. Okay, now I'm going to open it up for questions or comments, and you can just say them and then I'll repeat them into the microphone for our videotape. So does anybody have any questions or comments? Was that helpful? Did that explain kind of the waivers? It's like another whole language.
Who decided to do away with waivers and why?
So the waivers are still there. They're just getting away from the
waiver
list. Yeah.
Who decided, was it a state level, was it a?
So the waiver list, and I'm paraphrasing now even though I'm on videotape, but there was a lawsuit. And it was from the federal government towards the state of Ohio. And wasn't that the lawsuit when Kasich was running for president? So if you remember when Kasich was running for president, he was involved in a lawsuit. Well, this was part of that lawsuit. One part of the lawsuit was too many people with disabilities were in institutions in Ohio. So we had to start getting people out of the institutions and into the community.
So the federal government
Yes.
was suing the state of Ohio?
Yes.
Because the federal government
The
passed
Center for
something?
Medicaid Services. So then Medicaid was upset that we had such a huge waiting list. And so Ohio said, no, they're not all waiting. They've been on the list since they were born or they were a young person. And we asked them if they need this level of care, and many would say no. So there were many times in Gallia County we would go, because it's a small county, we'd hit the top of the waiting list. Because if you take a waiver, you have to use it. So we would ask, do you want waiver services? Like, do you want someone in your home to help you? And we had many people say no. No, I'm fine. You know, and that was even before this entire process going on. So I would say a strong 20% would say no. And it was really amazing to me. But they would just say, no, we're doing this a different way. We're okay right now. So it was a process, between the Center for Medicaid Services, which is federal, looking at the state of Ohio, and some families with Disability Rights Ohio sued the governor, the director of DD. It was a huge lawsuit. It's still going on too, right? I believe it's still going on, yes. They talked about maybe dropping part of it, but it's still going on. So that was the reason. And we were given so many years to make this transition. So I would say the last, 10 years, 8 to 10 years have been full of transitions and changes related to the concerns from the federal level.
So was there a panel of people who were part of the transition who said this is the best way to do it? Was each county involved in that, or was it just told, this is your transition process, do it?
It was not each county. So what they typically do with big things like this is they have so many people from the state, and usually the superintendents, there will be a certain number of superintendents from different sized counties. But in this case, they were told, here's the end. Like, here's where you have to end up at by this date. So that was non-negotiable from the federal government. By this date, people on the waiting list have to be able to be served within 9 to 12 months. So you couldn't have a waiting list that was 30 years long. You know, you had to actively be serving and working through your waiting list. So then the process was decided to ascertain, like, who has an immediate urgent need, who has a current need, and then to make that commitment if you don't fall into those two categories that were always here. So when something changes. And then also if it's decided that it's not an emergency or a current need, there's always, and you get a letter saying right now you don't qualify. I mean, that can change when any circumstance changes. And you can also appeal it to the state of Ohio. So the whole group that started this process, they have an appeal group as well. And so then they hear those appeals.
When does the assessment start?
When does the assessment start for the waiting list? Is there a certain age or?
No, any age. As far as when it starts, we've been doing assessments, so we are notifying people on the waiting list currently. We have begun, and if you want an assessment faster than what we're going, a family member can request one.
So we're, what was it, about 47% through the list? Through the waiting list that we had, yes.
Because I got a letter saying, you know, I guess everything was gonna be redone, they were gonna do assessments and just kind of wait, I guess.
Yes, so somebody will contact you to have that done. So to schedule that and to get that done. Yes.
So, I'm trying to think how to phrase this too. So, my son's been on the list for a long time. I mean, we're talking 10 years probably, 10 plus years. And it seems like his number always went down, or it actually went up sometimes instead of going down. So, are we ever going to reach a point where, I mean, sure, there's 4,500 people there now, but it seems like, I mean, there's more and more people now being added, there's more and more people asking. So right now, I don't necessarily need any needs, but, you know, in 10 years, when he's aged out of the school system and I'm looking for more and more care, are we going to get to a point where there's just nothing available until we do become, my husband and I are become too aged to care for him? I mean.
So something will be available if there is an immediate or a current need. So it doesn't matter how many people we give a waiver to. By law, we have to be able to give a waiver to someone with an immediate or a current need.
But
And
what
the-
happens if that gets to, like right now you said there's 1,500 people on a waiver. What happens if there suddenly becomes 5,000 people that have an immediate or an emergent need?
We have to meet that. So we don't have an
Right.
option to not meet that. So for example, when the tornado happened.
Sure.
Okay, so all of our needs went up, like in
Right.
one moment. Calling the state, and other resources saying, I know we're gonna need at least $500,000 more. Like, pull that out of somewhere and mail it to us, and they did. You know, like, they can do that. But we, as a county, have to express an emergency or an immediate need to be able to get that. So they don't do that if there's not something like the tornado. So that's the commitment of the state of Ohio, that's the commitment of the county board. So if something happened and your child has that emergency need or that immediate or current need that's not addressed through local funding or local resources, we have to provide that waiver. And it doesn't matter, I don't think there's a cap on it. I mean, it doesn't matter, you know. That's the county's commitment. And that's the part of kind of the way Ohio is one of 2 states. Is Colorado the other state with counties, or do you all know? Mississippi. So all the other states have like a state system. So in Ohio, though, we really like our system, and people actually move here for our system because it's usually more personable, and we're able to address and to do more things and actually come up with more funding at a local level when we're able to. For example, in Montgomery County is the only county in Ohio that offers recreation that's paid by the board. No other county. No other county in Ohio for DD offers mental health services. I only know of a handful of counties that offer family and support dollars to adults. So in Gallia County, it was children 12 and under. So most counties don't offer that as adults. So the leadership, the commissioners, the county administrator, the levy team at the county level has opened up greater percent of funding than a lot of county boards receive. You know, and I've already started talking to them about additional needs that we'll have with the waiting list assessment and how that's changed. So that would be my job, to go find that 37 cents of every dollar that it costs for a waiver. Something else? Uh-huh.
So, you're saying that notices were sent about these assessments, which I have yet to receive one, and I sometimes wonder why my child has an SSA, and I think I've heard from this individual maybe twice in the 10 years he's had one, and I understand in the beginning it was because the waiting list was there, but now that a new system is in place, I'm trying to figure out why I haven't. And this individual knows I have a need, because I've attempted to contact her on several occasions about this need. But
And I'm gonna let Kamar talk about this. He's the director of the SSA, so you need to pull that mic over there. I do wanna say one thing, because this is another caveat of the DD system that I failed to mention. So we are responsible for children birth to 3 through early intervention. And when they're school aged, I don't even know how many years ago this happened, they took the funding from us and gave it to the schools. Okay? So when your child is school age, we don't get funding until they either graduate or turn 22.
even if my child doesn't attend public school?
So I'm just saying that all of the money that we used to have for that age group is now through the schools, because when they integrated the schools and children with developmental disabilities started going to school. I know it's laughable in many ways, but I'm just explaining that that's what happens, and that's why a lot of times it feels like there's this limited interaction. And those SSAs have like an entire, I think, school system that they serve. So it's different than when you become an adult. But that did bring up that good topic about how the school-age children have, how many kids do you think are to one SSA?
Usually their case loads like 200 plus.
Okay.
So we have ESSA
Yeah.
assigned to the school to.
I know. It's the way the system was organized. And so if we put more SSAs towards that, we take the money away from waivers. Like, there's only this much money. And so by law, the schools are supposed to be providing those services for your child. So we do have SSAs, but they typically have large groups of students. Uh-huh.
So I'm just gonna ask you, you just said the schools are supposed to be providing those services. What does those services mean besides an education?
Does anyone know?
Therapy.
The therapies,
Educational therapy.
transportation, therapies.
They don't do after-school care for middle
Yeah.
school and above.
They're supposed to kind of, sort of.
Okay.
Yeah.
And therapies you have to fight for.
Yes,
once
so,
they go to
and-
middle school.
And
because
that's
they
a
want
lot
them.
through your IEPs. And
Right.
I'd like to bring in Gallia, I had like the state pit bull for IEPs come in and like train the parents, like to get them ready for those meetings, because you have to fight in those meetings, and I know that. I, as a parent, have fought in IEP meetings. So, yes, so it's through that entire process. And so they're supposed to provide those things. They're supposed to provide an integrated classroom setting with the least restricted education that's appropriate for your child. In Gallia County, we still had a school, the Board of DD, because in that county, the schools decided that oftentimes the least restricted meant the child stayed home. And they were taught with an itinerant, like that would go around every other week. So there's still a school there, just so that the children can go to school.
So do you guys as a county board work with the school systems? Do they know where to go to ask questions?
So do we work with the school system? The answer is yes, but in the history of the DD board, in my opinion, it's just kind of revving up. Like, don't you think in the last 10 years? Like with transition services and employment. So it's not been around forever, since 1967. It's really been, in my experience, like maybe the last
Couple years.
7 to, yeah, like it's still new enough that county boards are like, hey, do you have a brochure? We need to come up, because it's not something that's been in place ongoing. So transition specialists or people might interact with your school to provide those resources and kind of make that transition to after school. But the schools are supposed to provide that. And whenever I say after school, I mean when they graduate.
Okay, I missed something. So what happens when they age out of school and they do not have a waiver?
After 22.
So what happens at 22 when they age out of school and they do not have a waiver? Well, then in working with your SSA and after the assessment or whatever assessments are done, and I'll let you all answer this if you'd like to for Montgomery, it's decided what services are needed and what can be offered and what can be paid for locally.
Correct. And typically, the SSA is going to work with you to approve a day service provider. So, and based on what your child's ability and skills are, that may be a day service center, community employment, or some type of other service.
Okay.
We typically are using level 1 waivers to fund those services. So because you're going into that type of programming, kind of makes you a priority in a lot of ways to get that. So there's some continuity of care from the school program into that environment.
Okay.
So does the school initiate that, or do we as parents have to initiate that?
Well, in an ideal world, we started doing that around 14, we're talking about transitions.
By law, it's 14.
So between 14 and 22, I mean, clearly you can stay in school till 22. Some parents decide to graduate at 18 for whatever reason. But if you stay till 22, it'll be up to that point, 18. And then, you know, we try to have a plan for transition, because right now we probably have, how many day service sites now?
About 35.
35. So we have a pretty good array across the county, logistically throughout, so families have a lot of options to kind of choose for. Before we had the 35, we as a county were the primary day service provider in this county. And we operated 3 large facilities.
But doesn't each school district have a person that is supposed to help with the transition?
Yes, each school district will have the SSA assigned, then there's teachers.
But I mean, the schools, they're supposed
some
to
schools,
too.
yes, some
The
schools have
schools are
transition
supposed to,
coordinators,
but county boards have started across Ohio just because it was not always effective.
I was gonna say, we live in Huber, and the Huber School District's 7th grade. My son is 17, he'll be 18.
Now everybody's gonna move to Huber.
But when he turned 16, they told me, hey, we gotta start prepping for transition. I mean, like, he's with the ODD, I believe, for the job for the summer. I mean, like, everything. They were working with me now
Yeah.
with the whole guardianship when he turns 18.
See, that's great, and that's almost never the case. So that's wonderful, because usually it's the exact opposite of what you just said. Isn't that true? I mean, usually it's clawing and fighting and trying to understand. You could maybe do a workshop on what you just said, because you went through all of it. Yes, that's like all the things that should be happening, you know. Another thing that is a change in the field, not as drastic as the waiting list assessment, but still pretty significant. It's called employment first. And that is that each child, we're talking about the children leaving high school, have to seek employment first, or have to be assessed for employment. Now, I wrote my entire dissertation about this, so it upset me that much. Even though I think employment is fantastic and wonderful, I don't think that it's the best option for each child, for each student graduating. And so, and I feel that my research proved it. So I'm very happy about that. But right now, it is a rule that they have to go through that process with OD and employment and complete that before they can go to a day service, or that we can serve them in another way. So that's a step that has to be taken now. Yes?
Do the day services usually run like 8 to 5 or 9? What is the?
There are some day services that have a second shift. Mitch?
It varies. 8 o'clock, yes, is a common start time between 8 and 9 in the morning, and they end around 3 to 4 in the afternoon, and then some run up to 7, 8 o'clock at night.
So they vary. And then if somebody were going to that program and needed before or after care in their home, it would depend upon their level of need and the situation to see if that were funded.
But the schools don't, I mean, when she asked about after-school care, the schools don't provide that, do they?
No, but if they're offering after-school care to other children, they have to offer it to children with developmental disabilities. In this case, it's for children who would be of the age group that they would still need after-school care, but they've aged out of the typical care. So for that, we're looking at providers who serve adults right now, but who are done with their regular services and would be willing to step in. So we're looking at contracting or doing something to make that possible.
But I think it's just kind of educating all of us on how to find, to find what services are available. And especially, it seems like a lot of them are like the employment and all that kind of stuff, which unfortunately I feel like my son isn't going to be able to do that. So I think it's just, I feel lost sometimes in even what to ask for.
I know.
Because I don't know what's available.
But we do look at it, are they using what they already have? But if you have a reason for that, that would be, we wouldn't want to give someone a waiver and they hadn't ever used anything else, because we want to give that waiver to somebody who would use it. But if you explained why,
Right.
then that's what that would take. I think the whole parent information thing is kind of like an epidemic across Ohio. In Gallia County, we started a parent group. We enlisted a couple of parents who were super organized and would give some time to it. And we established a Facebook page. And they do meetings like this every month. And they would bring in the IEP pit bull to train them on what to say, and this person and that person. And I would be in the building, but I wouldn't participate because they might need to talk about me, but if they needed me, I was there. And it was really kind of an empowerment group for them to get information. So I've already spoken with Janice, our communication person, and Kamar, and some of the SSAs about working on getting that going as soon as possible. just because right now all the information deals with birth through senior adulthood. And it would just be really nice to have that place, whether it's for early children, early childhood, and then to have another spot for parents of the kids who are maybe end of elementary, beginning of middle school through graduation. Just kind of like, here's resources, videos, you could ask questions, and it would be easier maybe to get that information. So we're working on that right now. Other questions? And probably something, we had thought about doing, I'll probably just continue to have conversations like this until no one shows up. Until everything is fixed and no one comes anymore. But just to have a place to ask, because it really helps. When I was a new superintendent, we had a group called New Superintendents. And there's 88 superintendents in Ohio, so there was about 10 new ones at any given time. And it was so great because then you could ask all the questions that the other 78 already knew. And so this would kind of maybe be the group where you could ask any question or get that help and talk to our directors, our leadership, and get that information. Any other questions? Go ahead. Did you have a question?
Yes.
Okay.
So would it be fair to say if your child doesn't have like an emergency need, they typically won't get a waiver until they turn 18?
They won't even get a waiver at 18.
Unless they need it.
Yes, unless it's an emergency or what's called a current need. So that means we can't take care of their need without a waiver. So maybe it's a ramp. Like, okay, they're in a wheelchair, they really need a ramp. So that we would look at that and possibly just pay for it out of our dollars. Instead of doing that 37-cent to $1 match out of $1, we would just say we'll just pay for it because it's a one-time cost. So we weigh and look at all of those things. So, but if there is a need like that needs addressed, we would look at that. But the age of when someone gets a waiver completely varies based on their developmental disability and their level of need. So, and it's not whenever he turns 18, so it will be based on that level of need. So if he's able to live at home with you, if we put additional supports there, or what is he able to do, or so when you have your assessment, just be really honest, go through all of it, and then they assess it based on the criteria given to us by the state of Ohio. And then we'll determine, what level of need it is.
But how would you know when you are eligible for an assessment?
The assessments, by rule, have to all be completed by December 31st of 2020. So we had, when we started this project, we had 1,600 people on the transition list, they called it. And we're about 43% of the way through that list. So we've made some good progress, but we've still got a long ways to go. So we're kind of working through it in batches and through different age groups and different, I want to say like the SSAs are working on the people that already have a level 1 waiver because they're still on the waiting list because they may need something more in the future. So we started with them and did that at their redetermination. We're also working through some of the kids. At any time, if you want an assessment, you can call up and say, I want my needs assessment done now. We do those too. We have a committee that meets every week. It was supposed to be bi-weekly, but we've got so many of them that we have to meet every week, and we kind of review them, and then we kind of brainstorm and try to figure out what are alternative services that maybe could go into place. Like Pamela was talking about the ramp. If there's a ramp that's all you need, and you can get in and out of your house and you don't need anything else, then we probably would throw some alternative services towards that as opposed to a waiver. So just because you have a need doesn't mean a waiver is what you need to meet your needs.
Right.
So out of all the waiting list assessments, the 43% that have been done, out of that list, not quite 14% received a waiver. So that kind of gives you an idea of the numbers. And that meant, and right now they've been like urgent needs, like critical needs. And they were people that, you know, for whatever reason, we weren't aware of their level of need, their critical need. And so then they were able, so like you were saying, being on that list forever, well, this is fixing that for that 14%. And so that's kind of the process around that assessment. If you don't agree with what is found out with your assessment, you can appeal. And then there's a process for that.
So do they reassess for regular services though, right? Like at 16, 18, or am I mistaken?
It's every year, isn't it?
Well,
Is
6 and
there-
16 for eligibility.
Okay.
If I could add one thing, just to be clear, you don't have to have a waiver to get services. There are services without a waiver.
That's
There are
right.
respite services, there are behavior management services, you know, there are services you can get without without being required to have a waiver.
That makes sense, because I would think they would try to do everything first before going to the waiver.
Right, that's exactly right.
But do we have to pay for the respite services out of pocket?
Well, there are funds for that as well, so it's gonna depend. I can't tell you one way or the other. I don't know, Kamar, if you have a
Family support
better
service,
answer?
family support service dollars can be used for some of that, so it kind of depends on the activity.
Mm-hmm.
So we try to, you know, make it so that some individuals were able to participate just because of that reason. So do you currently access family support services dollars? Jess? Okay.
Yeah, but it's like 6.
Were you
They
here?
just
I
call it
increased it to
1400.
1,400.
Huh?
We just increased it to 1,400.
So it went from
So the
6
letter's
to
going out
14?
Friday.
Yeah. I do appreciate all the things that you guys do. You guys have been a lot of help, I will say that. Like my son goes to the recreation, he does the OOD. My SSA has been great. I think her name is Jane.
Okay, great.
She's been amazing.
And we'll just keep trying, so, you know, even with the behaviors or the aggression, and to get a behavioral specialist or videos or any information that we can use to help get more resources. Other questions?
I just want you to know that I feel like my biggest concern with the 13-year-old is, what does her future look like? As much as I wanna say I'm gonna live to 90 or 100, you know, I mean, I could get hit by a bus tomorrow. And when you say you're gonna be there, really you're gonna be there like the very next day? No,
Yes.
it's a process, it's gonna
No,
take time.
no, if a parent dies, I mean, we're there immediately.
So my concern is,
Like if a caregiver dies, and no matter what age the child, I mean, we immediately respond.
so, because I've seen on some of the special needs sites, parents who are struggling with behavior and with that sort of thing, and they don't know where to go. And so, so let me get back to where I was. So I was, so my concern is, like, I've lived here in Montgomery County for 10 years, and I don't know what's out there beyond high school. I don't know what to look for, what to plan, what to start even thinking about for her. As much as I want, live to 90 or 100, and let's say I die at 70 and she's 50, is it really fair to a 50-year-old to all of a sudden put them in some sort of a group home or something of that nature? So I always thought that it would be a transition, like you would transition into something when she was in her 20s. I guess I don't know, I am just nervous I don't know what's out there, I don't know what to ask, I don't know what resources to go for, I don't know who to petition, I don't know state, do we keep asking for that? I don't know what I don't know, other than my fear for what does her future look like.
And so as your child becomes an adult, are they seen by the SSA every year?
There's a ESSA, if she's 13 or 14, she's starting a transition process. So a
Yeah.
lot of things she just brought up, you're getting ready to go and start down that path.
Yeah, right.
So you know, not trying to say it's gonna happen, but it really is.
And they'll share with you resources, and then like I mentioned, I really wanna do something for our parents around housing, around, because there are resources outside of our DD system for housing. So, ways that you can bequeath your house into a trust, ways that they could maybe share a house with one of their friends. Like, there's a lot of really creative options around housing, and we can get a grant to bring those specialists here to kind of
So-
help figure those out.
I'm sorry, so I could leave my house in a trust?
Yes, so, and then it's usually bequeathed to the housing nonprofit. So,
With stipulations that
that your
does
child
stay
gets to
there
live there, yes.
Yeah.
until
Until they pass away, and then it goes
With
into the
support.
trust, right. And it would be based on their level of need, based on what we would grant. And then oftentimes, though, it might be with a roommate, or like with a roommate that they get to help choose. And so, I mean, that's a model that's being used in some other counties. And so then parents know that their child can always stay in their home, you know, and that it would be cared for. So there's ways to do that. They're really innovative and they're kind of outside of the box, and just a handful of counties are doing it. But I want to bring those people in for anyone who's interested. So we'd probably make it like a housing night, and then they would cover those kind of things. And then as you start the transition time, you'll be getting a lot of the information.
But with an SSA that's got over 200 on their caseload, like you said, the last meeting, they can't go to every IEP meeting, every transition meeting. So if she can't come, how do I, as a parent, go into the IEP meeting going, okay, this is, because the school's not gonna tell me what's available at a county level. So how do I educate myself before I walk into that IEP meeting,
Can I-
going, here's our transition stuff?
So I think like what she said earlier, like going to family meetings and like talking to other parents who have been through it, because you won't know. And like sometimes the people that work there, they don't even know everything. So when you talk to other parents, like my son goes to URS in Huber, and like they have like family nights sometimes, and I've went to some of those meetings, and I've learned things from other parents as well.
Right, which is what I'm doing.
Mhm.
But I think that the county needs to be able to provide us more information than just parent to parent.
Yeah.
I know, and that's something that they actually remove the funding for. So that's why we communicate such a limited amount in that time, in that age range. We do have the SSAs for the, you know, the larger groups. We are going to start the Facebook and a few kind of social media ways. So you can just say, hey, does anybody know what this means in an IEP? And then we'll do a grant with a couple of parents or figure something out so we can be getting answers.
Yeah.
You know, so you don't have to Google it all and then try to decipher it. You can say, what is this? What's URS? What does that stand for? You know, and then somebody can just tell you what that is. And so that's my goal with that. And then also to kind of promote and announce very specific activities and resources for that age group. We will do better to communicate. Any other questions? As we close, we'll just be here. So if you have specific questions, but I do plan on doing this probably every 45 days or so, or, you know, just, so if something else happens, just show up and ask it, and just to kind of provide that information. And hopefully before then, we'll have the parent Facebook up and going and some information out there, so we'll be able to start getting that out.